So I don't feel strongly about trying to push into that space. Now, an interesting question is, if we're going to be a little bit forward-looking, is, like TBCRC, I can't remember which one it was, but it was a study that was presented at ASCO showing that actually the ctDNA status at the end of neoadjuvant chemotherapy was more predictive of outcome than PCR versus non-PCR.
Mm.
And so if that holds up in a larger study, you can envision a world where people are stratified by residual ctDNA at the time of completion of their preoperative therapy, and then using that again as a marker of risk that might want you to try to intervene. I'm not sure that if one had a patient who had a PCR and then you were following ctDNA and it became positive and you introduced a PARP inhibitor, that's a completely investigational approach, and I don't know whether or not that would work.
Yeah, really interesting. And I think that's sort of a broader question for risk stratifying all of our adjuvant therapies, right, in terms of treating minimal residual disease.